My office manager's name is Meredith. She is fabulous, and she comes at me with a lot of medical questions, of course. So recently she asked, is having a lot of urine infections normal? Well, it is not normal, okay? And I want to talk a little bit about that. So women, because of anatomical reasons, are generally more prone to recurrent urine tract infections. But gentlemen can get them as well. And so is it normal to have recurrent urine infection? No, in either case. I had a patient who was getting recurrent urine infections, the burning, the foul odor of the urine itself, but she was going to urgent care each time it was happening. And she was getting a new doctor or a new nurse practitioner, PA, whatever it may be. She'd go in multiple times a year for the treatment of the urine infection. And it would clear up, but eventually what happened is she had blood in the urine or something like that, basically a more complicated urine infection. She did proceed to visit with a urologist, and cystoscopy, which is a camera that looks into the bladder, was advised, and she was found to have bladder cancer. So it's absolutely critical to get to the bottom of recurrent urine infection. Now that's a worst case scenario, right? This is cancer changing the anatomy of the bladder and resulting in the recurrent infections. But dryness can result in recurrent urine infections, and it could be also a very resistant microorganism. And so after the second or third urine infection, you may want to go ahead and do a urine culture to see if it happens to be a multiple drug resistant strain of bacteria. In which case you just change the antimicrobial and the infection should clear up. So yeah, that's just a brief rundown on urine infections. With gentlemen, okay? So we don't get urine infections as often, okay? If there's burning on urination in a male, you actually presume it to be a sexually transmitted illness. But certainly if a male is having a regular old recurrent urine infection,